Hello, this is Dr. Kathleen Thomas running for the Illinois U.S. Senate. What are your ideas on how to reduce the spending in Washington?
Well, as I like to quote Ronald Reagan when it comes to spending, he said, "Stop feeding the beast." And I believe that the number one thing that they need to do to get spending under control is to stop spending. I know it might sound simple enough, but apparently it's not. I believe that the citizens need to realize that there is not a limitless revenue, that there's X amount of money that we all pay into this amount of money. And whenever a legislator brings home the bacon, so to speak, people in other areas of the country are paying for that. And if a legislator here brings it home, someone else is paying for it. If a legislator somewhere else brings it home, we pay for it. All of the citizens of the United States are paying for all of this spending. There is none of it's free, and it's our money that they're spending. So we just need to stay within our means, live within our means, have that budget, stay within the budget, and like I said, just stop spending.
Mm-hmm. What are the positive aspects of our healthcare system today that set it apart from systems employed by other countries?
I believe that our healthcare system that we have in the United States has the best technology. We have specializations. We have whole hospitals that specialize, say, like in women's issues. Mayo Clinic, all over the United States, we have these wonderful hospitals. And technologically, I think that overall we are very advanced. And another thing that we have, and I've traveled all over the world, and I know this to be true, we have choices here. We have choices as to which doctor we would like to see. We have choices. We can go to any of the hospitals that maybe would specialize in some disease or some issue that we might have. So I think choice is just an absolutely wonderful thing that we do have here in the United States.
What are the major problems with our healthcare system, and what would be some of the solutions?
Obviously, cost is one of the issues, and that seems to be at the forefront right now with the health care bill. I am disheartened with that 2,000-page health care bill. Well, I didn't like the 1,000-page health care bill either. I read it, actually. I read the bill, and it didn't address any of the issues that I think should be addressed. It didn't address the cost, which I think is the number one issue. The health care, per se, is wonderful. It's the cost of the health care. And we can address the cost of health care, I think, on a couple of levels. The tort reform is one thing that we definitely need. I know that doctors order more procedures than they need to. It's called defensive medicine. They practice that because of the fear of lawsuits. And so if we could take care of that, I even thought it would be nice, instead of sending a situation to a jury, to have a panel of patient advocates, doctors, and hospital administrators, and let them decide. That might be a possibility, but something definitely needs to be done about tort reform. And of course, the other area is insurance. If they could make insurance, if the government would lift the mandates and regulations on insurance right now, where we could travel across state lines to shop, if they would make it more competitive amongst the insurance companies, then that would lower the cost right there. And to make insurance portable, and to be able to buy what you need rather than what a whole group needs that you have to buy into that program. If you could buy your own individual insurance, and all of that would lower the cost. And once the cost is lowered, and we still will have uninsured people, I understand that, but we also have Medicaid that they could, the lower income people can get insurance from. And not to stray too far afield from the question, but if we were to root out all the mismanagement, fraud, and waste that's in Medicaid, we would save literally hundreds of billions of dollars, and that would help us insure those that are without insurance. But we will still have one small segment of the population uninsured, because that's the nature of democracy and the nature of the beast. But they would have access to the emergency rooms, and they would still have access to care.
How do you suggest we reduce our energy dependence on foreign countries? Do you support more oil exploration and drilling, or nuclear power in the U.S.?
I do. I support more exploration. I support studies on wind energy. solar energy, nuclear energy. I think we need to explore all aspects of alternative energies. And I believe that if we would give non-political incentives to the scientific community, I believe that that would help open up a lot of private sector technology and research for these sorts of energy sources.
Do you give any credence to the August 2009 climate feedback article by Drs. Lindzen and Coy from MIT and the emails from scientists at the University of East Anglia Climate Research Unit, or do you believe the science is settled?
I do not believe the science is settled, and I have an interesting story about that. Last summer, I downloaded the Cap and Trade Bill and I was studying it, and they were talking about the IPCC reports put out by the United Nations. So I went to those reports and I started studying those reports. And I was halfway through one of the studies, and I called up an energy consultant. Actually, he's a developer, an energy developer, and I had a question. I said, I'm reading these IPCC reports from the United Nations, supposedly the ones that Al Gore used, right? And I said, I'm not seeing this global warming situation, and I'm not even seeing a climate crisis. I said, because I had read in the report, it mentioned something about raising the ocean level 8 inches in 200 years and a couple of degrees in 100 years. And I said, I don't see where the crisis is. And he told me, he said that most legislators or their aides read what is called the executive summaries or the political summaries of these reports. And because the ones writing those reports have a political agenda, then they skew the report or slant the report the way that they would like to have it read. So legislators read that and they buy into what is really not true. I mean, I went to the actual reports, and this is something I did without a staff or without assistance. And I also read Dr. Lindzen's testimony, I believe it was in 2002, to the Senate Environmental Committee. And he discussed how the scientists had political incentive to, and I don't want to say to report incorrectly, but to maybe skew the results or yes, absolutely. They were biased, if you will, in their reporting. And he just made, Dr. Lindzen made perfect sense the way he talked about the science is not settled at all. But apparently there is definitely no global warming, and probably not a climate crisis, and I don't believe there's any anthropogenic cause of what we're experiencing.
All right. Do you believe amnesty should be granted to those already here, or should they wait behind those who came here legally?
I believe that definitely they should wait. I think Americans are usually more than fair, if you will, in situations like this. I don't believe we have a collective will to deport. Estimates range from 12 to 20 million people. I just don't believe collectively that we want to do that. But definitely they need to pay a fine, go to the end of the line, and I believe, number one, what we have to do is secure the borders so that we can keep track of who we have and who's coming in, and make sure that those that are coming in are documented.
Whether a Democratic majority or a Republican majority, large spending bills which may not have passed if they stood alone have been attached to more favorable yet unrelated legislation. Do you believe this is an acceptable practice, or should all legislation be debated and voted on independently based on its own cost and merit, or at least grouped with related bills?
This has been from the beginning of my campaign something that I would really like to see changed. One bill, one vote kind of legislation is what I would like. I understand that some bills are grouped together, let's say like the Department of Transportation, but to have unrelated bills, and especially to have an unrelated bad bill tacked onto a really good bill, because the legislator knows that's the only way it will get passed, I think is totally wrong, and I would love to see us get away from that, either through passing legislation saying that you have to have one bill and an up or down vote for it. But it's definitely got to be simplified, because it is so complicated, and so many bad bills get passed this way by tacking them onto a good bill.